Hi, I'm Dr. Wayne Alani with Southeast Texas Orthopedics Tenet Healthcare Group, and today I want to discuss with you actually an incredible surgery that is done these days called total knee replacement. Now, I know that's scary and you're going to hear from a patient that actually had this procedure done, but I wanted to just go over for you a little bit of the details so you understand it's nowhere near as bad as it sounds, because when you hear the word total knee, you think somebody's taking out your whole knee joint and putting a whole new everything, ligaments, etc., and that's not really what it is. So we're going to go through that for you real quick. If you have an arthritic knee, and most people know whether or not they have an arthritic knee, there are some simple things you can do to try to treat yourself at home. There's obviously this mnemonic called RICE, which is rest, immobilization, compression, elevation when you have these episodes of pain with your knee. There are medications called anti-inflammatories, Motrin, Advil. These are all anti-inflammatory drugs. There are some precautions to those, so you need to talk to your doctor about them if you're taking them for a long period of time. There are injections that can be done. This is more of a short-term solution, not a long-term solution. So let's say you do all that. You've tried bracing, you've tried medication, you've tried the injections, etc. You may be a candidate for total knee replacement if your bones are rubbing together or you have so much arthritis there's no space left in your joint. So in regards to what a total knee replacement is, this is a knee joint, a model obviously. This is the front of the knee looking this way. This is the femur bone and the tibia bone, and what's happened in this person is that the knee has been replaced. You can see the end of the femur and the top of the tibia, and these are the two portions that are replaced, as well as the underside of the kneecap. Now I know this looks like a really big surgery. So this operation takes about an hour. The patient's usually in the hospital for 1 day, sometimes more if they need to be, but usually it's 1 day. They go home that day or the next day. Usually we get home health with them at home. Then they go to physical therapy and walk. They walk on the knee. The main thing with these is to get the bend back and to get the knee straight. So that's the work the patient has to do. But it's an incredible invention, and these really last a long time. And they do, a couple of the things I hear in the office that maybe I can clear up. One is, can the arthritis come back? Again, just going back real quick to the model, you can see when I turn it to the side, the end of these bones is replaced. That's where arthritis forms. You can't get arthritis again once these parts have been replaced. So that's number one. Number two, I've heard that it only lasts 10 years. These are what the patients always ask. Not true. I mean, we have many of these patients that we did 25 to almost 30 years ago, and they've been fine. So it's not to say that it's going to last forever, but it's going to last for many, many years. So those studies that were done are kind of older studies, and the newest implants, I believe, will last for many years. So if this is something that you think might help you, then what you should do is see your family doctor, and if he refers you to an orthopedic surgeon, it's something that may benefit you in the future to get you mobile and get you walking again. That's total knee replacement. If there's any questions, you let us know. I'm Dr. Wayne Alani with Southeast Texas Orthopedic Group.